Hi guys, welcome back to Your Face Unfiltered. I'm Dr. Keith Ladner, double board certified facial plastic surgeon. And today I have the pleasure of having our COO, Kelly Herbert, on our program, who's going to be asking me some very difficult, hopefully not too difficult questions about our practice.
Yeah,
Welcome.
thanks for letting me join you this morning. I'm just going to jump right in with the questions. So, Dr. Ladner, patients can Google any surgeon, see fancy titles and credentials, but what should they actually be verifying? You're double board certified, fellowship trained in facial plastic surgery. What does that mean? And can patients look up malpractice information, history, or disciplinary actions? How do they find the best surgeons?
Absolutely, yeah. So all of those things matter, of course. And I think that by the time a patient has come to our office, they've done a decent amount of research. They found out that the people that they're going to be interviewing are double board certified. Their specialty is going to be facial plastic surgery for facial cosmetic surgeries that they're interested in. But I think beyond that are some of the other intangibles, or maybe not even intangible, tangibles. Most importantly would be photo galleries and demonstration that this truly is their specialty. So if you're coming in for a facelift, you want to see hundreds of examples of results. You want to see that this truly is their niche, that they have vast experience with that particular procedure. If they only have a few photos for that particular procedure, then it's probably not their specialty. Either that or they just finished their training and they don't have a lot of years of experience under their belt. So that certainly would be number one. Number two would be the experience that the patient gets coming into the office. And so from the first phone call, how warm the staff is, how knowledgeable the staff is, do we treat our patients with respect, and is it going to be a good experience after surgery? And then also just seeing the office setup. So the surgery center that we have in-house, I think all of those things really play into the kind of global experience that a patient's going to get at our office.
Great. And there's something that you do at your practice, and I'm wondering if this is a good tip for patients, but we've had patients ask us before, well, can I talk to one of your patients you've had surgery with? Should a good surgeon be willing to allow a prospective patient to talk to existing patients who've already had surgery?
Absolutely. Because, the reality is that I've never had these surgeries, right? And so I can go off of 15 years of doing this and tell patients, hey, this is exactly what all my patients tell me post-operatively about their experience, from pain to swelling and bruising. But I think that one-on-one conversation with a patient who's actually gone through it and lived it is so important. Mm-hmm. And if a surgeon doesn't have at least 10, 15, 20 people for a particular procedure that can be serve as a reference, then again, they might not be doing that procedure very often.
Right. That makes a lot of sense. Yeah. Okay. Well, so then speaking of having that experience, how many facelifts does a surgeon need to have performed before they're really proficient? And what's the difference between someone who also does facelifts versus someone who specializes in facelifts like you?
Yep, exactly. So I think that there's never really a stop or cessation to the learning curve. I think that despite doing this for 15 years, I'm continuing to learn. I'm continuing to try to better myself as a surgeon. So the learning really never stops. We continue to get better at these procedures. But I would say that if I look back, it was probably between years 5 and 7, being out of training, that I had hundreds of these procedures under my belt. I was doing the procedure a little bit better probably, but I was also more efficient. And so I could do a facelift now in say 3.5 hours versus taking 5.5 hours, and still doing the same quality of work and probably better, to be quite honest. Getting back to the second part of the question, which is someone that says they do facelifts, maybe they have a few photos for facelifts, but it's not truly their specialty. I always use the terminology that they're dabbling in that procedure. And so that may mean that maybe their practice isn't busy enough if they just do perhaps breast augmentation. And so they want to try to maintain 100% occupancy rate in their OR, so they're going to offer all procedures, but it might not really be their specialty. And that's where the before and afters and the reviews that you see online are so important, because you're going to absolutely be able to kind of tease out whether or not this is what they do best.
Great, makes sense. So now I want to ask you about our anesthesiologists that we have at the practice. I know that our anesthesiologists are board certified for every surgery, but I've learned that's really not standard everywhere. So what do some surgeons use instead, and why should patients care about that?
Yeah, absolutely. So this is a big one. So at our office, we only use MD board certified anesthesiologists. And the reason being, really lots of reasons. Many states allow for surgeons and cosmetic surgery centers to use anesthesia assistants or CRNAs. And the problem with that is that technically that surgeon is actually the anesthesiologist of record. And I think a lot of patients don't know that. And so that means that the surgeon is actually supervising the CRNA or anesthesia assistant or whatever the state allows. And they never had proper training in anesthesia, right? So that's number one. Number two is a surgeon should be able to focus completely on the surgery itself and not have to worry about the safety of the patient. They know that the patient is in the best of hands, that they clearly are having and truly having someone who has the most extensive training that is going to be providing that anesthetic. So very important for patients to ask. If they don't ask, I'm going to volunteer that information during the consult.
So do you think that's why some of these surgeons now are doing these awake facelifts that we see, in-office facelifts with just local anesthesia? Is it because it's easier than using a board-certified anesthesiologist?
I think it gets into the economics of what we do. So this is a self-pay business. We're not taking insurance, right? And so when shortcuts can be taken, there can be a little bit higher profit margin. So for example, if you're doing an awake facelift or with minimal sedation, what that means is that you're not employing and hiring an anesthesiologist to be there, so you can capture some of that revenue.
Got it.
And so I think it really comes down to economics. I don't always think that that's the best thing for the patient, even though it can sound very attractive to patients to say, hey, you can do this under local anesthesia, no anesthesia required. We're operating around very important structures. For example, a facial nerve and a deep plane facelift. And so if there's any chance of that patient moving because they truly are awake, that really puts them at increased risk. So I'm a firm believer that patients should be under the appropriate level of comfort during the procedure, and it is going to be different depending on the procedure they're having.
And it sounds a lot safer.
Exactly. Yep. In my hands, I feel like it's the safest if you're doing a true deep plane facelift.
So let's talk about the deep plane facelift
Yep.
differences. You specialize in deep plane facelifts,
Yep.
but not all surgeons perform this technique. Why not? And what happens to a surgeon who does a deep plane facelift when they're not really experienced in that?
Yeah, I think that what I'm seeing is that a lot of surgeons are advertising themselves as deep plane facelifts because they do realize that if they don't advertise them as such, that they're probably going to lose patients because patients understand that this truly is the gold standard. Now, the gold standard changes, and 10 years from now, we might have something newer, better, and sexier than our current deep plane facelift, right? But we always have to keep up with the trends. And this is where ongoing training, going to courses, conferences, learning from our colleagues, learning from ourselves is so important. There's a lot of surgeons that, again, advertise themselves as deep plane facelift surgeons, but I think they're doing more limited versions of the procedure, and especially in the neck. So they're not doing true deep neck sculpting. And their deep plane technique might be just a little bit of undermining of the SMAS layer, which we'll get into later. And doing a little bit of SMAS elevation, but not a true release of the entirety of the SMAS. So I think that it's really important for a surgeon during the consultation to go through and demonstrate their understanding of a deep plane facelift, of a deep plane neck lift. Because if they're not doing that during the consult, they're probably not actually doing that procedure.
Makes sense. Okay, so let's talk about the consult. Let's talk about red flags. So when patients tell me about consultations they've had elsewhere, I hear things that sound really concerning. We just had this happen a couple of days ago.
Yeah.
What are the biggest red flags patients should watch for in a consultation, like big promises, high pressure tactics, or book today discounts?
Yeah, I'd say all the above. In fact, the list is, it's very lengthy in my opinion when it comes to red flags. So again, I think the red flags start at the time of the phone call. So if the staff is not warm and empathetic and compassionate and educated and can answer questions before the patient gets into the door, that's already, in my opinion, a red flag. Second would be the consultation experience. And again, making sure that patients feel heard. They're getting all the information, relevant information they need to make an informed decision. So spending time with patients. We demonstrate procedures using, visual, their actual photos, so we can draw on it. We can educate them on incisions where they're gonna have bruising and swelling. And I think that one thing that we hear time and time again with our consultation process is patients come in, they say, I've been to 2 or 3 consults and I didn't get anything like this at my other consults. It was sort of an in and out of the door experience. So that would be, number 2. Number 3, going back to what you said, is we're not trying to force people into surgery. In fact, I'm trying to figure out whether or not this patient is a good fit for me and my practice and my staff. And if I feel like the patient is demonstrating red flags in terms of not being a good fit for what I offer, I'll actually tell them that and say, hey, maybe you're a good candidate for the surgery, but not here in our office because I don't think you're the right fit for us. So really kind of interviewing each other, I think, is important as well. And then like we said earlier, the photo gallery, the reviews, making sure that the whole package kind of adds up, right? Because if the consult's great, but then they can't demonstrate a lot of before and afters of that particular procedure, or they can't offer references that patients can call, then they're probably, again, not doing many of that procedures, and they might be using a little bit of trickery. So, yeah.
Yeah, and I'm thinking back to earlier this week, we had a patient who was in for a rhinoplasty consultation. And in our office, our patient care coordinator starts out with the patient, and then you speak to them, and then they'll finish up with the patient care coordinator. And in this particular situation, I remember the patient saying, well, I met with another local Denver area surgeon, and she shared his name, and she said their office told me, if you have a rhinoplasty that takes longer than 90 minutes, that's a red flag. That's not a good surgeon. They then said, well, if you have a rhinoplasty that bruises for longer than 7 days or has swelling for longer than 7 days, that's a red flag. And those things were concerning to hear, I think, from your standpoint, from the office standpoint, because we never make hard promises. Every body responds differently to surgery. We kind of have estimates of how long it takes for bruising and swelling to subside. Every surgery is a little different, but your rhinoplasties frequently take, 2 to 4 hours, just depending on the complexity of the case and the type of work that's being done. So why would a surgeon be promising 90 minutes, and isn't that kind of a red flag?
Yeah, I think so, because again, I think that's kind of a one-size-fits-all approach where we're putting everyone into the same bucket that says, okay, well, every nose should take 90 minutes. Some noses do only take 90 minutes, or maybe even less if I'm just taking a bump down and doing what's called osteotomy center of the nose. That's going to be a very short rhinoplasty. But the average rhinoplasty that comes in, they need attention to detail. That could take 3 hours. It could take 4 hours, exactly as you said earlier. So we can't just do a one-size-fits-all approach when we're talking to patients. That's over-promising. And bruising, for example, I have patients when we take the splint off at a week, they truly have no bruising. But you can't say that that's going to happen 100% of the time, and that just becomes unrealistic. So what we like to do is give ranges and say, hey, based on our previous hundreds, thousands of patients that we've done these particular procedures in, what is the average range that you can expect, right? So for facelift patients, I'm usually telling them, you're going to probably be able to get out into public at 2 weeks because the bruising and swelling will be down enough to where people aren't going to be looking at you, staring at you. You might be going to dinner with your spouse at 3 weeks because you truly are going to be feeling a little bit more confident. But we never say hard, fast promises that absolutely at 2 weeks all the bruises are gone. We tend to give more ranges to make things more realistic.
Yeah, to me it sounds like when people are giving hard, fast promises, it's just a pressure tactic.
Right.
Whether it's with price or promises, and those are red flags we should stay away from.
That's right. Yeah. I mean, if things sound too good to be true and they don't add up with what you're reading online or what you've heard at other consultations, they usually are too good to be true.
Great. Well, that's all my questions for today. Thank you so much.
Thanks for being here.
Yeah, absolutely.
And if you liked what you heard today, please be sure to like the video and subscribe to our channel.